Thanks, Annie.
Lovely. Cheers, bye.
Adult trauma call, 8 minutes. Adult trauma call, 8 minutes.
I've got an unconscious gentleman he has severe traumatic brain injury.
Kings College Hospital, London.
I think something hurt.
One of the busiest A&E departments in the country.
They're a bit busy right now. Yeah, 20 minutes, 30 minutes.
Kings is extreme, isn't it? Come on.
A place where love, life, and death unfold every single day.
Fall from a tree. It's probably absolutely trolleyed.
I'm very drunk.
I just keep thinking, how am I going to cope?
All the patients you're about to see were treated in one department in just one 24-hour period.
Cavino! Everyone should walk through an emergency room at least once in their life because it makes you realise what your priorities are. It's not the rush, rush, rush and the money, money, money. It's the people you love and the fact that 1 minute they might be there and 1 minute they might be gone.
I will do assess for number 4 if you want me, because Maria's doing this one.
And I need to
Yeah.
take a number.
Every day, King's A&E treats patients with anything from a cut finger to life-threatening illnesses. For the staff, it's a daily encounter with all aspects of society.
It's quite interesting being in this bay because you can see so much going on.
Definitely in A&E, you learn the nice things and you learn the harsh things of life. Like you learn there are people out there that really have no respect for other people. They're just out for themselves. And then you see the nicer side of people. Like, you know, they're going through a really bad time and they're still considerate of you, of other people around, and sorry to be in the way, sorry to be of trouble. And you're like, you know, you're the reason why we're here.
Hello.
Hello.
This was me quickly.
Oh, shall I move?
You're very well, thank you. Considering.
Well, you're not very well. You wouldn't be here otherwise.
If you're well enough, you're not here.
No.
We got you.
Silly question, isn't it?
You've got to say you're very well, haven't you? Even if you're not. You've got to be optimistic.
74-year-old Ted and his wife Irene are on their 10th visit to A&E this year.
You are Mr. Ted.
That's right.
Just short for Edward.
Short for Edward.
Yeah, my name is Edward.
Oh, right.
Oh, two Edwards together.
And this is your lovely wife, is it?
Yes. Thank you for that compliment. We were next door neighbours, really, and sort of it stemmed from that. We used to go to work together on the same train, and that's how things developed. He would meet me for a drink and that, and then a couple of times when we were coming home, because we used to come home on the same train, he used to hold my hand, and I thought, oh, he's just being, you know, just neighbourly sort of thing, but not realising what he was possibly suggesting.
You all right? Hi, Ted. It's all right if I call you Ted.
Yeah.
And I'm Maria. Just find out what brought you in here today.
Well, I've got a cancerous tumour in my bladder.
In your
Bladder.
bladder, okay.
And basically it's terminal. So.
Okay. Are they going to do any treatment? Are they going to work you up for chemo here, or?
No, the chemo's no good.
No good. Have you had chemo?
No. But what they said, it's no good for the bladder.
So what brought you here today?
Well, my GP took some bloods earlier in the week, and then when I went to Guy's yesterday, they did some more blood tests, and about 11 o'clock last night, they rang me and said, it's got worse. We suggest you get yourself into Kings.
Oh, my goodness. OK. Well, listen, what I'm going to do now is I'm going to do a set of obs. I'll attach it to the monitor. I'll get some bloods off on you. I'll make sure that bag of fluid is going through. We'll test your urine and we'll get you a cup of tea. All right? OK.
Fair enough to the doctor. He said, we can never say it will be this, it will be that. We can only give you an approximate time. Might be a little bit less, it might be quite a bit longer. He said, but I'd say a year, 18 months.
So we just make the most of what we've got left, which I intend enjoying, so.
That is a fantastic attitude.
And
Well, let's see if we can get these problems sorted out.
yeah,
And then...
I feel sure you will, because I had a very similar thing in the summer. And
is it difficult not to get attached to some of these people that you treat?
In general, I don't want to sound hard, but in general, no, it's not. And that's just the nature of A&E. You're not nursing a ward of patients. It's transient, it's continuous, and you have to move with it.
getting very hot.
Yeah, it is actually. You can do me as well. Oh, lovely.
Oh, God, can you just stop hurting, please? Just for a second, just be like, you know, be cool. Silly leg. Silly leg.
A drunken night out has left Ian with a broken ankle.
Hiya. My name's
Hey.
Jess. Hi.
Sorry, what's your name?
Jess, hi.
Jess, nice to meet you, Jess.
Nice
Ian.
to meet you. So, what were you doing?
I feel like such an idiot again. Yes, I was skateboarding.
What time in the morning?
Yeah. Well, drunk. Yes, Jess. Yes.
Okay.
Okay, it's as ridiculous as it sounds, and yes, I feel
in the
it.
ankle or
Yes, it's
the-
entirely in the ankle. And there's just a bit of bruising. I scratched my knee, so it's fine. Yeah. It hurts when I stand on it. Yeah.
Where were you skateboarding? Down some stairs? Or?
Well, no, between God, just going down the shops to pick some more beers, which is a sensible. Yeah, that's pretty sore.
What about
Yeah.
there? Okay. I'll grab an X-ray and we'll go to it.
Sorry for wasting your time.
Oh my God, no, don't worry.
Oh.
Kevino. All right, I'll just get everything ready. I can see you're not scared of needles or them tattoos. Oh, can I borrow a piece of your tape, sir, please? It's a good place to keep it there. Thanks. I finished. Yeah.
When she's on shift, nurse technician Amanda takes blood, inserts drips, and attends all trauma calls.
Once I take this off, my uniform off, I'm the same as you. Well, I'm the same underneath it. It's just, I like doing things for other people. That's what makes me happy. If I was to do things for myself, they'd never get done. But if I was to do it for you, you'd be done like that. I'm not going to smoke today. Let's see how long it lasts. A lot of the ambulance guys call me Peggy Mitchell. Hello. Barbara Windsor. I've not got the assets though, but never mind.
A 40-year-old man has been kicked in the face whilst playing football.
We're just going to get you over onto this trolley, all right? I'm Amanda, this is Emily. Can you shuffle over, mate? We're going to need to get you undressed, and we'll just sit your trolley up a bit. And then we'll move your trolley over to the monitor. Going to need to shave a little bit of that chest, mate.
This is 40-year-old Duncan.
Yep.
He was playing football and had
think he went for a tackle and the start of the other player went into his face.
Thank you very much. Oh, don't worry, Duncan, we'll get you fixed up. What I'm going to do is pop a cannula in. It's a thin tube, it's left in your vein until you go, and it's just in case you need to have some further treatment, some painkillers or anything that you might require, and you don't need any more needles. So can I have your arm? You pop it nice and straight. What position was you playing in? Oh! Should have been a goalkeeper.
Should have been a song.
Sharp scratch. Excellent. Lovely veins, Duncan. Makes my job a hell of a lot easier. I just wanted to ask you, Duncan, what was your surname?
Anderson.
Anderson, lovely, I got that. Well done. Well, you want to eat one of those Cadbury's Bliss? I had one last night, the new one. Oh, yeah. Peeled the chocolate, got the inside, you know, because it was so nice, you just want to savour every minute of it. And that was my treat to myself last night, was one of those.
Can I tempt you with a banana? Don't fancy the orange. So you haven't got a temperature?
No. I'm getting bored now.
Have you got a fluid chart, honey?
I don't think it's actually going.
No, I don't think it is.
Maria?
Maria? Yes, dear.
It's actually dripping.
Is it now? Let me get a flush and sort it out.
It's all right to call you, isn't it? We never know.
Jakers.
Thank you. Times I tell him.
Oops. I do the exact same, actually. Well, I started training 20 years ago. God, 20 years. I suppose, like an awful lot of other people that go nursing, kind of very idealistic. Not that you cared more, but you were a lot softer in the way that you looked at things, I expect. Yeah, things affected you differently. Like, everything was wow and oh my God and poor them kind of thing, I suppose. Tea okay?
It was okay, but I couldn't get it down.
Mm-hmm. Mine was all right.
Was it okay?
Yes.
All right.
He's a very gentle person, and like he likes his art, but he sort of introduced me to art, and I thoroughly enjoyed it. We love going out for walks. I think your tummy's a bit swollen to normal. We're companions to one another. You know, we just sort of clicked. It was just strange, really. You just felt, oh yes, this is the person I'd like to be with for the rest of my life.
Come here.
Just put your head up a minute. I'm just going to support your head a little bit, all right? All right?
Oh, God's sake, bloody leg.
A&E minus.
They're gonna do the blood, yeah? Extraction. Take the blood, put the needle here.
I fucking hate needles.
Huh?
I hate needles.
Yeah. If you, I'm telling you, if you...
Let's just not talk about this. I'll deal with it when it comes along, you know?
Yeah?
Yep. Ignorance is bliss.
You got a good pen here. Okay. You've got very, very good pen.
Thank you very much. Let's... Cheers, pal. Oh,
painkillers.
Fantastic, thank you.
With a sip of water.
Am I allowed any more water, is that it?
Yeah, just a sip.
I'm pretty thirsty.
Okay, yeah.
Well.
Taking more medication and then having a little...
Oh no, let's not do this. Come on. And should we just... We'll do this another time. Should we do this tomorrow?
No.
Tomorrow's a good day.
You're going to operation theatre. And then
Let's do this after the operation, though, when you know...
No.
Yeah.
They're going to give you anesthetic there, so...
I know. I'm
you
just...
don't have to
I'm
escape.
just...
You're a big man.
I just hate needles, man.
Okay. How many balls
Give me a bowl full of cockroaches, just no needles.
How many... What did you drink last night? If you drink, you're not allowed to do skating, yeah?
Come on, man, like...
I'm sorry for mess, yeah? The blood is on the floor.
It's cool, man. It's cool. Joy of joys.
All I need is going home. So...
Oh, that's a lot of blood.
Yeah.
Did you have to make such a mess? Come on, man.
Well, the thing is...
You said you've been doing this for 20 years. Look at this.
Yeah, but this is unavoidable. You're so active.
I'm sorry.
It's not my
You're
fault.
wasting my precious blood.
I know. Okay.
These are my favourite jeans.
Hmm?
Is there any chance I can get an iPhone charger?
My name is Kevin Hillman and I'm a porter. We're actually on the front line of A&E. I've seen stabbings, I've seen shootings, I've seen people with dislocated shoulders, broken legs. So we are the most important department in the whole of the hospital at the moment because they're coming in 24/7.
And on the way, can you bring him to X-ray?
There's another porter sitting down in there.
Well.
Sometimes it can be difficult. You just have to be focused and concentrate and just get on with the jobs, what they ask you to do, mainly. But they're doing chicken and chips for £1.99 and the chicken shop.
Much money. Where's the money? So rent is going to...
Can we have a porter to X-ray, please? It's a porter to X-ray, thank you.
I quite enjoy it. I've got friends here. I know some of the doctors. I know some of the nurses. I'll get on well with them all.
Kev, I'll treat you to a little coffee later.
No, that's all right. Don't worry about it.
No, you bought me one. I'll have to return the favour.
Just get me a Red Bull later.
All right, I'll get you a Red Bull because I'm going to need a Red Bull.
We can fix it, don't worry.
Well, it's not as bad as I thought it is. Okay?
Okay, good.
It's not as through and through as I thought.
Okay.
Your tooth might be quite sore because it's probably...
It's all bruised, and yeah, no. As I consider myself very lucky. Hello? Put it this way, when I talk, I can feel my top lip flapping around from just below the nose. but just tell Jonesy and John that I'll still be prettier than them.
Adult red phone, 6 minutes. Adult red phone, 6 minutes.
Indy, was that an adult red phone?
There was there's a cardiac arrest and there's a peds trauma.
A patient has arrived, having suffered a heart attack.
Any change rhythm? Has he been PA throughout? Okay.
Amanda is a key part of the team administering CPR.
Do you feel any pulse? I can't feel a pulse. Okay, that's PA. Can we continue CPR, please, and give some adrenaline as soon as access is secured?
Adrenaline going in.
Thank you very much. 12 minutes past was the first adrenaline, so...
You sure you don't want another line? The minute it arrives, it affects me. The minute it's in the door, it affects me. Because I know, potentially they're not going to survive. So, but, it does affect me a lot. Is that going, Dave?
How long has that been? Do another cycle, please. Thank you.
Go.
You had one last cycle. You had she had there, yeah.
I just think let's try and get them back.
With that in mind, so PA. Should we do one more cycle and then if there's nothing from there?
Well, I think we're doing a pulse check now. I think it's no pulse.
Thanks very much, Simon. Thank you. Cool.
Let's just try to
It's only afterwards that you sort of put the picture together of the person. It's when I go home that, and I'm on my own sometimes. That's when you might have a little cry or release, but not when I'm at work. You could have had one situation where someone's died or, there's a major trauma and then 10 minutes later you've got the same situation again. So you have to be professional and it is hard.
Amanda.
Kevin, did you get your...
Yeah, did he make it? No.
Every year, 7 million people have accidents at work.
Nikolai Koichev, please.
So are you a doctor?
Nikolai, a builder, is one of them.
I was 4 hours here.
We're super busy today. Usually, when you wait very long, it means you are not super urgent.
That was...
But it looks nasty, I agree.
What happened?
Cut the finger with chainsaw.
Oh, nice.
Very nice.
Okay, the X-ray does look quite alright.
Yeah.
The bones are not injured. We have to check that the tendons are right.
So you can save it?
Yes, I'm pretty sure, yeah.
Very painful.
Okay, good, you're very brave. And it was a chainsaw?
Hedge trimmer.
How do you call it?
Hedge trimmer.
A hedge trimmer, okay.
Are you British?
No, I'm German.
What you doing here?
Decoration, just look good and
Why
walk
not
around.
in Germany?
It's good work here.
Better money here.
Yeah, as well.
I saw in Germany is better.
I mean, you came here as well, isn't it?
Yeah.
My job as a foreigner is as well to adapt to national habits.
Do you like football?
Yeah, very much.
Do you know Balakov?
Yeah.
He was playing in Stuttgart.
He played in Stuttgart, isn't he?
He's Bulgarian, yeah.
Yeah. I got the hint, for example, from nurses that you can't say this or that straight to a patient. Even if it's just a small thing, like give me your arm, I have to take your blood. You should imply a little bit more, darling, please, would you mind? Unfortunately, I have to. I know it will hurt a little bit, The German way is see the problem, make it known, and solve it. Will it hurt, doctor? Yes.
How long are you working in here?
3 months now. And there before I worked in Africa.
Oh, yeah?
Yeah. It was like here. You can get shot outside.
How old are you?
33.
Are you married?
No.
Cute?
Cute?
With girls wanting you?
Single at the moment, let's say it that way.
Tadeusz Bros.
Yeah, hi.
Okay, take it easy.
Sorry, yeah, okay. Yeah, I got splinter in my thumb.
Okay, let's have a quick look.
Yeah,
Yes.
but it's not very fresh. I got it like, I don't know, it's hard to say, 1 month ago or something like that.
A month ago.
And it was like hard skin build around it.
Okay, and what's made you come in this morning then?
Nothing special. I went to a Peckham walk-in clinic first, and they said, no, we can't. And they sent me here. It's nothing special. I really just realized it's not gonna come off naturally, so
okay,
I need to someone to take it off, I'm afraid.
Okay, grab a seat back out there. Listen for your name. Doctor will call it through that door, and we'll have a look at that for you.
Cool, thank you.
I've just tried somebody who's got a splinter in his thumb for a month.
Doctors are trying to establish why Ted's kidneys aren't functioning.
And again. How long have your kidneys not been working very well?
I had again in June when I was in, and I had a reason.
Can I interrupt?
Yes.
12th of May, he had acute renal failure. Do you want that?
Could I borrow this? I promise I'll bring all this stuff back to you.
No, you can keep that. Yes.
And this. I'm just going to write some things down, just make a sort of plan of what I want to do with you. I'm going to try and admit you, basically. And I think you need IV antibiotics. All right?
Thank
okay,
you.
that's all right.
I didn't do an ECG. I don't think she needs one.
Well, he doesn't think it's anything serious, does he? It is a very worrying time, and you try and put to the back of your mind what might be. You've always got, no, we're going to succeed, we're going to beat this. You mustn't think, oh, you know, this might happen, that might happen. You've got to be positive all the time.
Mr. Peacock?
Yeah.
Hi, I've spoken with my colleagues, the waterworks doctors, and they will take you in, and they're probably going to try and arrange a scan for you, whether that's a ultrasound scan or a CT scan over the weekend, just to figure out what's going on. We'll try and get to the bottom of it, but they're the best ones to deal with it. Is that okay? And that's kind of my involvement over now. Yeah. All right, but I'm sure.
Thank you very much.
I'm sure they'll look after you well.
Thank you for all you've done.
All right, you're welcome.
So if they're going to start doing ultrasounds or CT scans, they obviously think there's something there.
Well, there obviously is, isn't there?
I hope it hasn't spread somewhere else.
Well, it's a good thing you're here and not at home and wondering, isn't it?
Getting me worried now. I mean, right, I'm going on in a few weeks, I don't know, a few months.
Okay, what happened?
Yeah, around 1 month ago, I'm not sure, but it was like a while ago.
Yeah.
I got a splinter in my...
1 month ago, my friend.
Around, yeah.
Yeah. You know what?
Yeah.
Go to GP, okay?
Yeah, really?
Yeah.
I went to GP today, and they sent me here.
No. That's
Really?
GP. That's GP thing, obviously. Look, it's 1 month, okay? So it's not urgent.
In Peckham walking,
Yeah,
he said, I can't do that.
Okay. but your GP can make you an appointment for surgeons if you want to, because I
have no time.
Yeah, exactly, because you're not in emergency.
All right, cool. Yeah, it's fine.
Sorry for that.
That's all right.
Okay,
cool.
Alan has brought in his 77-year-old mother, Peggy. She's been attacked by a pit bull and broken her arm.
He's insured. I'm going to get into a solicitor on Monday, and I'm going to sue him for breaking her arm.
See, they took my coat away where the dog was trying.
Because the dog attacked this. When I came back and saw her, and I came with my dog for a walk, there was all like mouth bites all over it, like where the dog had been trying to bite her attacker. So the police took this away, and they done saliva test. Must have took the saliva off it and put it in a bottle and sent it off. Is there any way my mum could get a wheelchair at the hospital? We lend it to her, loaned, or go home with her, or get her about like. Right, tell mate.
So tell me once more what happened.
I was attacked by a dog.
Okay, and it was this morning.
Yes, I was going to pay me poll tax.
Okay. Yeah. And the dog didn't bite you?
No, but he went to bite me. I was on the floor and he was pulling me coat, trying to get to my arms and my legs. Well, I mean, the 2 breaks in a couple of weeks.
What happened to your other arm? So this,
I slipped
this
it.
one happened today and this one is new, isn't it?
Yeah.
The more the people are in pain, the more serious, let's say, the injuries are, the less they complain and just say, doctor, do what you have to do. Especially the older ones, I guess, having suffered from the war.
Have you had this one in the past? Yeah? Is it still on?
And you wanted to have it symmetrically, so you went searching for a dog.
Do the 2 legs next.
Yeah, I think she'd like to come up to the hospital.
Next one is free.
He's going to prod that in a minute. Start prodding it.
Okay, and I already can hear it snapping. That's very good. So we moved it. Yeah. Are you all right? Okay.
I was painting this.
I stepped on a nail and it went into my foot.
Oh, thank you, Jesus. Thank you.
Yeah, buddy. But I am refusing to put money on that vending machine, but I'm refusing to pay 70 pence for a pair of sneakers, but I'm tempted though, fam. I am so tempted. I just keep looking at the bar of sneakers and thinking, yeah, that money would do me good. Just go in there, just get it. It's like, I can feel the coins in the pocket as well, but I'm hungry and I'm tired. And I need a nice little long bar. So, is there any chance I can have some headache tablet? My head's really banging.
Do you just take the seat in cubicle 6?
No, wrong way. Oh, let's just do it.
Okay, well done. You're very brave. You're doing very well.
Oh, Jesus Christ.
Seems deeper than what I thought.
Don't say stitches, please do not say stitches.
Are you not happy to go for stitches?
No, I'm not happy with stitches. I'm being serious. I do not like needles in any way, shape or form.
Gluing is not a problem. We can do the gluing.
Yeah.
But it might leave a scar over there.
That's fine. I will take that, but I do not want needles. I know I'm a big lad, but still, when it comes to stuff like that, I'm a wuss.
I know. Okay. Right. I'll need to have a forceps for that. Okay.
Does it look bad?
It looks much better than I thought.
It's going to make me look hard.
A little bit, yes. That's my concern.
Hello, it's Sharon.
How many beds have you got round there? 3? Brilliant. Fabulous. Fabulous.
Saturday evening.
Hello, Kings A&E.
Sharon is the senior sister in charge of resus, the department where the most seriously injured or ill are treated.
I sometimes do think, oh, why didn't I work in a bank or something and earn loads and loads of money and be jetting off around the world and having a jolly nice time, but I'd probably be a bit bored.
Hello, Kings A&E. All right, thank you. Adult red phone in 5 minutes.
Because turnover's so fast and you are running round doing so much for so many different people, and it does all merge into one a bit.
Oh my God, this is ridiculous. Hello, Kings A&E. Fall from a tree, 25 foot. It's probably absolutely trolleyed, I'd imagine, if it was up a tree.
Oh, right, here we go. Hello.
I'm never going to get a break now, am I?
It's a request for a whole-body CT. A 20-year-old male patient fell 25 feet out of a tree onto rough ground. Possible loss of consciousness at scene.
I'm going to put a finger in your back passage. You have to tell me if you can feel, okay?
Thank you.
CNN.
Stuart. Okay, Stuart, how's the pain getting on? Okay. So what were you doing up the tree, dare I ask?
Can you remember?
I don't know. You don't know? Do you remember falling out of the tree at all?
No.
All right, okay.
He was up there cutting branches for the bonfire, weren't you?
I see. So where's the most pain at the moment? In your back, in your tummy, or in your legs?
In my spine.
In your spine. All right, okie dokie.
I like to live life on the edge. If life's a breeze, then it's not really that entertaining for me. I have to be dangerous sometimes to feel like I'm living, basically.
I'm going to tell your mum when I know what's wrong with you. Yes, I am. I'm not going to not tell her.
Don't worry.
I don't care.
Don't tell her.
No, I have to tell her.
How far did I fall from?
How far? About 40 foot. I can describe Stuart in one word: stupid.
What was I doing?
Exactly. What the hell was you doing? Because this is the stupid things you do when you have a drink. Isn't it?
Ted is waiting for a bed on a ward so doctors can carry out further tests.
Actually, Debbie, will you throw me in a piece of gauze off the IV trolley? Debbie, will you throw me in a piece of gauze off the IV trolley? A piece of gauze off the IV trolley.
Oh, I heard you.
You're right beside me. She's a bit Mutt and Jeff anyway. The best of times.
I don't know, what is it about people like that make you instantly like them? And I think it was that, you know, you walked in, he was very polite, and just that he was so positive, and that came through, and it wasn't false. He was really genuine, and you felt that from the time he started speaking.
Where's your wife gone?
She's gone home.
Is she?
Well, we've got a disabled daughter.
Oh, have you?
Yeah, she's got MS.
MS. She lives with you?
Yeah.
God, you have a lot of stress, haven't you?
Yeah, she's had it. She's 29. She's had it since she was 17.
And how is she with the MS?
Got worse.
Has it?
Yeah. Her walking's very poor, and her eyes is the other thing. She's really so partially sighted. Anyway, I think she does pretty well. She don't do too badly, really. She is a worry. And then I'm a bigger worry now. So.
Well, we have to get you sorted out, don't we?
Yeah.
Get you home.
neither of us were too worried. We knew he'd probably be feeling fairly poorly, obviously, but as in the past, they gave him these intravenous things, and in the end, everything turned out all right. So we weren't over-worried. We were worried that the infection had flared up again and wondered why.
And we're ready.
Jolly good.
Now, do you want me to top?
Can you just push that bag round so you don't fall off? Lovely.
But that's it, isn't it? That's A&E for you in a nutshell. Like, you know, you can have people spitting at you, swearing at you 1 minute, and then you've got the likes of Ted and his wife coming in. You know, you don't always get the privilege of spending that time with them.
Take your hands in now there.
Oh, yes. I'll get a slap.
Thank you. Okay, we're just going to wait for the results of the scan now.
There's not a lot really that happens that I've not seen anymore, and it has to be something pretty awful. You know, a lot of the time I walk out the door, I close the door behind me, and that's it, done. Then, you know, I'm out of work then. I'll be thinking about other things that are going on in my life, and you can't take it home, all of it home with you. You just can't.
I've got no answer for it. And because you're silly, you drink too much and do stupid things. And you don't listen to me.
It's stupid to go up there, knowing that I was drunk as well. I regret it now, because now I've got to live with what happened. People keep telling me not to go in trees again, and I probably won't be going in no trees.
Permanent damage, have you? Is that what you're asking me? You broke 2 ribs. And you've broken 2 veins in your spine. You're very lucky, you know.
You get tired out talking, don't you?
You can do, yeah.
Well, you do,
Yeah.
you can tell.
You
do.
So,
But you've got to stay positive. We all got to stay positive.
well, that's what I try to do.
We did grow closer and closer as time went on. You know, things that you thought were very important first of all, not so much later on. You know, we were companions, we were husband and wife, we were soulmates, as they say. It's so difficult to try and explain how you really feel. You know, you just, oh, I do miss him.
Did you say she was with him? Oh no. He only died tonight at 11:15. Fuck, why didn't I go up? They didn't know whether it was pre or post. He had bladder CA and he'd been to Guy's and he was just a champion. Sorry, it's just 6 in the morning. But he really had a great attitude and he had a 29-year-old daughter with MS. And he was like, you know, adamant he was going to survive. There is patients that will get you, and there's probably 4 patients that I'll remember like Ted. For him to have such a positive outlook, and it can't but inspire you. But yeah, there are people like Ted, and there's a few Teds in my career that I will always remember.
Kings A&E, can I help you? 16-year-old query stroke.
16-year-old query stroke?
Yeah. 16.
Wow, I had stroke.
I think an A&E department deals with people in every aspect.
She says she's suicidal and she has a history of 74 previous suicide attempts.
It's a place where they can come when things are out of control and they need somebody to look after them.
Kings A&E. Lovely. Cheers, bye.
Adult trauma call, 8 minutes. Adult trauma call, 8 minutes.
I've got an unconscious gentleman he has severe traumatic brain injury.
Kings College Hospital, London.
I think something hurt.
One of the busiest A&E departments in the country.
They're a bit busy right now. Yeah, 50 minutes, 30 minutes.
Kings is extreme, isn't it? Come on.
A place where love, life, and death unfold every single day.
Fall from a tree. It's probably absolutely trolleyed.
I'm very drunk.
I just keep thinking, how am I going to cope?
All the patients you're about to see were treated in one department in just one 24-hour period.
Kevino! Everyone should walk through an emergency room at least once in their life because it makes you realise what your priorities are. It's not the rush, rush, rush and the money, money, money. It's the people you love and the fact that 1 minute they might be there and 1 minute they might be gone.
Kings A&E has more than 200 permanent employees. Around 60 are non-medical. Staff who work behind the scenes to keep the department functioning 24 hours a day.
Good morning, Kings A&E.
From porters to receptionists, cleaners to security guards.
So come away.
My name's Vincent McCarthy. I'm the ward clerk come support worker in the emergency department. Because he's saying that he wants a black top that had Adidas on it. Now that one doesn't have Adidas on, but we have a black top here
Finton oversees the stationery and clerical needs of the department. He's also responsible for lost property.
I haven't had a good look, but yes. Oh God. It's really, really heart-rending when you can't get property back to people. You take it home with you, unfortunately, you know, and it's upsetting. But that's the kind of thing where you've got it back to somebody and you see the smiles on their faces and they're happy to get it back. That's the best feeling in the world, yeah. Well, if this is not his and he comes down, you know, he's going to be really annoyed. I know. It is a very responsible job, I mean, because it's just a ward clerk job, but another aspect of it is keeping an eye on trolleys, because the trolleys that patients get wheeled around on will get broken and need to be repaired, and I have to report all those kind of repairs on trolleys. What's wrong with this one again? This bed?
That one, it ain't going up at all.
Won't go up and down, yeah? Okay. Sounds like a trivial little thing, but it's all important and it makes a difference. Excellent, thanks for that, Golden. Thanks, bye. Excellente. That's that sorted, that's that sorted.
Well, the cylinders have been done, I've ordered them. That's a good thing. Everything's going to plan. But I still don't like Mondays.
Ain't that bad, really, in here, considering it's a massive hospital, like for the...
It's only Monday, isn't it? Monday morning.
Yeah, normally it's packed, isn't it?
Yeah.
After the weekend things.
Yeah.
Isn't it?
Yeah. True.
Mondays are very busy. We don't use the Q-U-I-E-T word in the department, ever. As a little sort of superstition, we tend not to use that word, and everyone says, oh, don't use the Q word. Oh, no. Look.
Could Dr. Oliver please call 2398?
They're all jammed inside.
Majors, Jackie speaking. Basically, the emergency department is a 24-hour open front door. You can't control what comes through the front. The gates are always open.
Adult trauma red phone in 4 minutes. Adult trauma red phone in 4 minutes.
4 minutes? Yeah.
It's filling up though, isn't it? Yeah.
Sorry, Sharon. It's just number 5, love, please.
It can go from having just 3 patients to then, in the space of 20 minutes, those 3 patients turning into 7 patients. Because we have 1 red phone, which will be a stroke, 1 red phone that's a trauma, another red phone. So you've now got, you know, your numbers have doubled in an instant.
Adult trauma call, 5 minutes. Adult trauma call, 5 minutes.
Can we have a hand in here, please? Don't worry. Just relax.
Now, Kelly, we need to get this kid analgesied up. I have 8 patients in resus. We need something else, but I've got 8 patients and no room.
If we can't get people out of the emergency department, then we grind to a halt because there's only a certain number of trolleys on which you can assess patients. No worries. Thanks, bye.
Okay.
Ridiculous.
Fucking shut up. Chatting shit about where some stone microphone. Just shut up, you're annoying me, bro. You shut up, man. Fuck. Hey, look, can you tell me what's happening here? Because I swear I'm starting going mad. Okay. The person's called me through to the X-ray. I go through there, yeah, and they're telling me, raw, no, go outside. I've been here for 4 hours, yeah. I'm in pain. What the fuck's going on?
No, wait. Let me just bring you down a step. You see what this says? You can't be talking to people like that. We're here to help you.
In resus, where the most seriously ill are treated, there are 5 bays, and they're filling up quickly.
Okay, lovely. All right. Sometimes it can be a little bit soul-destroying. Feel like you can't see them anywhere because there's no space and they're not going out the other end. And when the ambulances just keep coming and lining up out the door, it's just that sense of not even impending doom, it's just doom's here. It's queuing up. Frustration out with love.
Exactly.
Frustration out with love. I'm taking the trauma bleep from 4 because Soph's got to go and there's a trauma arriving. When the newbies come on at 4, can we make sure at least 2 of them stay up here? Because we've kind of got a bit of a backlog now. Thanks, hon.
No, spit it out.
No, spit it out, spit it out.
Don't swallow it.
Oh, I really don't like sputum.
Oh, I swear. I'll do it again.
Have you finished?
Okay, deep breaths, keep breathing, keep breathing.
Adult trauma call, 15 minutes. Adult trauma call, 15 minutes.
It's getting beyond a joke now. Hey, is Jen? What was I going to say? Is there any beds coming up your end? When your bed comes up, can you just ring Resus? Because they've got one that's going to be an overnight stay, and I'm just going to fill you with overnight stays, if that's okay. Cheers, Yusuf. Bye.
Sometimes you just think, what am I going to do with all these patients?
There is no beds for people to go to, that's the problem.
At Kings A&E, Monday is nearly always the busiest day of the week. It's late afternoon and the department is at capacity.
Yeah, Mondays are horrendous. I don't like Mondays.
Yeah, Porter to Resus, please. Porter to Resus for an urgent transfer to CT. Thank you.
And very stressful.
We don't have CDU beds to keep these people. They're after, honestly, we don't. I mean, we've got no medical beds now.
At the end of the day, no one's gone to see their GP over the weekend because GPs are closed. So everything is quite slow and everything seems to just build up and no one goes anywhere till like 5, 6 o'clock in the evening.
Now, just like I did it there, I'm just going to go around the side, all right?
I'm not. Tell me when you're going around the side, and I'll tell you if I can feel it.
Okay, here.
Oh yeah.
Okay, I'm just gonna...
Oh, sugar lump! She didn't tell me you were.
Be all right now.
I think we're trying to find some security.
Relax.
In Resus, all 5 bays are now full.
You just hope that a couple of people need to go to CT, so you can move the other people in there and do a full assessment and then move them out when the CT runs are done. Hopefully you might have one that needs to go to theatre straight away so you can get rid of another patient. It's just about managing them and trying to manage your space.
Can I just say though, Jeff, can I just say we in A&E are not all right at the moment. Because we're really not all right.
Whether they mean to or not, interactions can become a bit tense. I think everyone's, aware of how critical the situation is.
A&E Kings.
A call comes in from the London ambulance service. An 18-year-old has multiple stab wounds.
Oh, brilliant. Thanks so much. Bye.
His condition is critical.
Red phone, 8 minutes, please.
8 minutes?
Yeah.
Attacked outside a local shop, the stab victim has lost a life-threatening amount of blood.
Oh, you can't because you've got stab wound in your back. I'm still getting a blood pressure of 66 over 29.
What?
66 over 29 blood pressure.
Really?
Yeah. Pulse rate of 95. No drug allergies, no past medical history. Sorry, I'm just shouting at everybody because they're not listening to me. Do you know what happened tonight? Do you know where you got stabbed? No. Do you know? Where does that hurt? He's just examining your bottom, okay, where you've been stabbed in the bottom. 1, 2, 3. Oh, hold on a minute, there's a stab wound. There's one just here, I think, I'm not sure. Yeah, there is. There's a little shot. There's a small stab wound just underneath the armpit. And a large one. Yeah, and a nasty one just there. And one on this side as well. There's a nasty one on this side as well.
You've got to be able to change tack quickly because you have to cater almost for the worst case scenario all the time.
Can you do me a favour? Down there, just give me some gauze and a bandage because I've got 2 big open wounds here. I'm just stop the bleeding because it's bleeding and it's losing more blood. So go and get one of the A&E resource doctors to come and do a fast scan in here for me now, if you wouldn't mind.
I think the sample should be...
Can I get an urgent adult chest X-ray in recess, please? That's an urgent adult chest X-ray in Bay 4 in recess. Thank you.
You know, if it's a chest stabbing, you're going to get cardiothoracics down. If it's something with a really nasty, obvious brain-type injury, you might ask for neurosurgeons to come down and be there at the time. So you're trying to coordinate people.
Guys, I've got a chest X-ray here. Do you want a chest X-ray more urgent than anything else, yeah? OK, 1 second. What do you want? Yeah.
I think it's kind of like, you know, little ants running around all over the place because there are people madly trying to get their little thing that they've got to do organised. So the anaesthetist people, you know, anaesthetic people are checking all their airway kit. There's sort of this hive of activity.
Hold on a minute, hold on a minute. Hold on, I'm coming. What do you want? Yeah. I was just telling you, he's got an arterial bleed in his bottom, it's blood all over, he's just losing blood, like. But he's had 3 units so far, Jen. They've done he's on his 3rd unit at the moment. He's got a 4th unit to go through, but he needs some FFP. Sharon was saying something about FFP or something.
Yeah, that should be with the code red blood.
I'm going to get you some more dressings, hold on a minute. Don't know his hospital number or name. No, that's not him.
If I look on here...
No. That's him.
He's got a picture of it there.
Morphine. I know this is really horrible, DJ. Just try and lie there and just try and relax. I know it's really hard, mate. I don't think I'd be able to with all these people around.
It is stressful. It is stressful. You know, you're thinking on your toes. You're thinking, you know, all the time, oh my God. You know, and sometimes you think, this is really bad. But, you know, it's great. And then you save someone's life and it's absolutely amazing. There's no better feeling.
An hour after arriving, the stab victim's been stabilised.
Hello, mate. Is it all right if I just...
It's a bit kind of chaotic down here today, isn't it?
Yeah.
It's not your average Monday, is it?
Yeah.
It is? Monday's a bad day?
Mondays is a horrendous day. How's your pain at the moment, darling? All right. You let us know if it hurts, OK? And we'll get you something for it, all right? Yeah? Good lad.
Sometimes you can somehow magically, and I couldn't write down how it actually happened afterwards, but somehow it all just works and it happens and all of a sudden the patients disappear because they go to the right places or what have you. And so sometimes it's really rewarding because you sort of sit back and think, I don't know how, but we just made that work and we managed to do good for some people.
That's just the way it is. It can calm down in an instant. would just be like a mill pond and nothing happened, and it would just be, you walk into resus and there won't be any patients, but you'll just see the carnage all over the floor.
I do see what's going on in resus and the blood and stuff, and I kind of thought that although it's an emergency department, it'll be all the nurses and doctors that deal with everything, and I'll be removed from that. But I'm not.
Red phone 10 minutes, red phone 10 minutes. Thank you.
What we got then? What we got?
Collapse.
Query
86
calls.
collapse, 86-year-old collapse.
88-year-old Omar has been brought in by ambulance after suffering severe stomach pains. The ambulance crew suspect he has an abdominal aortic aneurysm, also known as a AAA.
Narrow pulse pressure. 87. Acute abdo pain, sweating, clammy. What do you think?
AAA.
AAA.
But not that tachy or hypotensive.
Not yet. Maybe it's about to burst.
We really went into the hospital kind of expecting that the medical staff will check him out and then say, well, you know, you've got a stomach bug or something like that and he'll get better.
One slide, ready, brace.
All right, sir. I'm going to sit you up.
Stick out your tongue.
Hello, hi, my name is Prem, one of the A&E doctor. Hi, I got a patient, he's an 87-year-old gentleman. Complained sudden onset of abdominal pain, severe abdo pain, and felt clammy and dizzy and weakness. His blood pressure on the right arm is 170/96 and left is 144/88, and also abdomen is very tender. My impression is look like AAA. I spoke to the vascular surgeon. He recommended to do the CT abdomen chest. So.
Was very, very bad, the pain. Over the years, we kind of got used to seeing him move from this healthy, strong, big man to something different, not quite the same as he was, not as healthy, always in pain.
Omar's scan confirms an abdominal aortic aneurysm. If he's not operated on immediately, he'll die. But his chances of surviving surgery are only 50%.
That's the situation. We'll run around and arrange things. We'll get into theatre as soon as we can. This is quite a safe environment where he's well monitored, okay? So probably he'll stay here and go directly from here to theatre when we're able to clear a space in theatre. I know they're currently doing another operation, okay, in pretty much all the theatres, including the emergency theatre. So that's the situation. We'll come back and speak to you as soon as we have more information.
Yeah, that's a very good point.
Sometimes they say, am I going to die? And you go, no. And you think, they can actually. That's horrible. But you can't not say no, can you? You couldn't say yes. Am I going to die? Yes, you are, actually. I do apologise for that. Of course you're going to say no. going to say no. We're going to do everything we can, mate. Don't worry about it.
Omar's evening started with stomach pains. Now he's facing life-saving surgery, but with only a 50% chance of survival.
All right, sir, well done. We're going to give you something for the sickness, all right? OK? All right, fella. All right, well done.
I think touching somebody is one of the biggest things you can do when they're in a stressful environment.
Well done.
Could be all they need just to relax a little bit, because it is so scary. It's that touch, that warmth is important, I think.
All right. Any more, sir? Still feeling sick?
I have spent a couple of times holding someone's hands while they've taken their last breath.
You can't help but being moved by something like that. From the point of view of the seriousness of what's going on in their life and how you're sort of almost involved in their life. You're pulled into what's going on with them. It's silly, but I mean, it has an impact. You go in and it has an impact and you feel it. What is it? Who is she? The cat, what is it?
Who's she? The cat's mother?
Yeah, that's it, the cat's mother. I knew you were going to say that, yeah.
No. Who's her?
Her. If you just think about the stressful things all the time, it really can get to you. You have to sort of take a break and do something that you enjoy. I used to be a DJ, you know.
Did you really?
I did. Back in the 70s.
Honestly?
Honestly. I'm like a human jukebox.
Well, I could go sooner if you like.
Continue fine, I hope it may, and yet it rained but yesterday. Tomorrow it may pour again, I hear the country wants some rain. Let people say, I know not why that we shall have a warm July. Tomorrow it may pour again, I hear the country wants some rain. Let people say, I know not why that we shall have a warm July. Tomorrow it may pour again, I hear the country wants some rain. Let people say, I know not why that we shall have a warm July.
Are you on any medication for your fits or epilepsy?
Yes.
And what milligrams and how? When did you last take it? These are what I need to know.
This morning.
Yeah, this morning. And you take it once a day?
No, twice.
Twice a day. And you took
20-year-old Norman has epilepsy. He's admitted himself to King's after fitting repeatedly today.
Cool. So you take 600 and you sort of, right, cool.
That's what I'm talking about.
Can you get some PR diazepam from the fridge, please?
Okay. Has he got oxygen on? Yeah, he's got oxygen on. Has he got a line in?
Yeah. Yeah. It's very delicate.
Do we know what he's normally on, this boy?
It's one in a different language.
Sorry?
He's also on liquid.
So he's not on phenytoin? Not allergic to anything?
This drip is going to go any moment now.
Oh yeah, I'm just in the spaghetti land. Just relax. That's it. Yes, NJ, you're fine. You're fine.
Okay, well done.
You're fine.
NJ, no, you're okay. Stay still for me. We're just putting your drip back in. You're fine. You're okay. You're okay.
This is starting.
Just rest the arm for me.
We just need some tape and stuff because it just won't stick. NJ, just relax. You're fine. You're in the hospital. You're in the hospital. You've had a seizure.
Just relax.
Jesus.
If I hold his arm.
I got his arm. I got his arm. You bandage.
Me bandage.
I think you'll find most people who work in emergency departments, they like the variety and they like the thought that there's always some, I guess, adrenaline situation potentially around the corner where you've really got to have your wits about you. So sats are 100, blood pressure's coming.
I think it's just sitting here.
With the right medication, Norman's symptoms can be managed.
And we'll probably run another venous gas, hey, why don't we?
But he'll suffer seizures for the rest of his life.
I'm tired.
Yeah, I'm
I had 8
tired
patients
too.
most of the day, night.
I'm tired too.
And I can't have 8 patients in here again. I might lose it.
Omar's condition is deteriorating. Before he goes to theatre, his son has to sign consent forms to show he understands the operation is risky.
He was sort of kind of very powerless, and he had kind of given up and left everything to me. He just said, tell them to do whatever you think they want to do.
Yes.
Hi,
Hi.
my name is Mr. Ritter.
Hi.
Should we just sit
Yeah.
down for a second?
Sure.
Basically, his main pipe in his body, the aorta, has blown. Yeah, it has rupture and it's bleeding. Okay. Now, without an operation, it's non-survivable. Yeah, it's certain death. So we had a look at his images, and we can do an operation for him, which is a minimal invasive operation, because an open operation he would
It's
not
not
survive
going to
either.
survive, yeah.
Okay. Now this is a life-saving procedure. Okay. The mortality rate with that procedure is about 50%. Okay. But if we don't do it, it's 100%. Okay. All right. Bottom line is, though, if you want to save his life, you need to do something. You need to do it now. Okay. And since his English is not very good and he's not in the best state, that's why I'm explaining it to you.
Okay.
All right. Yeah. Are you happy for us to go ahead with the operation?
I think so. There's really nothing else that we can do.
There's nothing else we can do now. We think he's got a chance to pull through, otherwise we would say, listen, it's not.
Being there completely on my own, I felt this huge sense of responsibility and loneliness at the same time. I mean, emotionally it was hard for me because, you know, if he didn't come through, it would have been me who signed the paper and let him go through all that.
So that and you consented on his part. All right. Okay. Good.
Okay, well, I think I better call my mum. Hello. Well, it's not too good. It's got an aneurysm. It's a blood vessel, one of those blood vessels that goes down from your heart. It's burst and it's bleeding a bit. So they have to take him in and operate and do a graft and sort of sort it out. Well, it's a risky operation, you know. If they don't do anything, you know, is going to die. If they're going to try and sort it out, but you know, it's a risky operation, so you know, 50-50.
No.
I actually think it's sometimes harder for the relatives or the friends that are actually watching, because the patients sometimes are quite out of it. They're probably on painkillers and stuff, so their perception of actually what's going on around them, even though it might be scary, is probably not what you and I, who are completely stone cold sober, actually see of that situation, you know? And I think sometimes to spend a bit of time with the friend, the family or the partner or whatever is quite important, as well as spending time with the patient.
A 33-year-old man arrives in resus.
We just bung him in one while that one's in X-ray. Udo, keep him there for a minute. We've got one free for a second.
No other medical problems.
Hanie has tried to kill himself. He's taken a lethal cocktail of drugs at his mum's house.
Mirtazapine, Penrindril, quetiapine, citalopram, omeprazole, diazepam, temazepam.
And heroin.
And heroin.
We're not sure of the time.
It's very hard, very, very hard to see your child there, you know, and you don't know he's alive, dead.
Annie, we're just going to put a needle in your hand, OK? You need to keep nice and still for me. All right.
Do you want to turn him? Oh, stick this up his bottom. That's it, mate.
Oh, relax. All right.
Bung his... He's clenching his butt cheeks. I can't get anything in there.
Hello.
Hello.
There we go. All right.
Do you want to try it your side? Come on, mate, lie down, would ya? Trying to help you, sunshine.
I went next door and he was unconscious. He was just lying across the bed, no cover over him, and he was freezing, he was so cold. He was icy cold. It was scary because I thought he was dead. It was literally like he was dead. I couldn't get him, wake him up or anything.
Hello. Hello. Wake up. Come on, talk to your mum a minute. She's worried about you. She needs to get home and get some rest, yeah?
I remember speaking with the nurse there. She seemed to understand as a, you know, she seemed to understand what I was feeling. She was just nice to me.
That's not on, is it?
She did understand, but she also was used to it, as she told me. She sees it every day.
All right, darling. All right.
It's not a new thing for them. They have overdoses in every day.
Hanie tried to kill himself tonight.
That night, I was 100% sincere in what I was doing. In every aspect that I can think of, I was at my lowest point, so I decided to put an end to my life. I took 1 whole week of medication at one time, and then I injected 1 gram of heroin and 1/2 gram of crack. And that took me to... and then I remember just waking up 4 days later in hospital, in intensive care. That's what had happened.
How are you doing, honey? Honey? Yeah? Open your eyes a bit more.
I think the first time I actually tried heroin and crack together, I was 18 and a half. The buzz was almost instantaneous. So within 30 seconds, you're on cloud 9, and I love that feeling.
Open your eyes again.
First time I realised it was a problem was when I had an overdose
Any pain
at the age of 24, 25, and I went to hospital from a cardiac arrest.
Can you wake up a bit more, please?
Very quickly, I found my life becoming unmanageable. I left my wife, I left my children, I have no family. Basically, it's destroyed me in every single way. I have nothing, basically.
All right.
I just wanted it to end, you know. I was fed up. I was always thinking about my children. I don't know how my children look. That, you know, hurts me now. You know, I just wanted to go to sleep and that would be it. No more pain, no more anguish, no more drugs, no more people pointing the finger at you, no one judging you.
Can I have some tissues from behind there? Sorry.
Surgeons are ready to operate on Omar. He has a 50% chance of surviving the procedure.
It was like a finality. It was like as if that the last time I would see him alive. I think that's what I thought when I went in. And I don't think I've ever said to my father, I love you. And I don't think he's ever said it to me.
Şeyde geçecek birazdan. Terlediğinden. Hadi tamam baba, Allah yardımcın olsun.
I did feel that, you know, if he goes in now and it doesn't come through, I would never have said to him that I've loved him. I should have done. I was very hopeless. The only thing that really went through my head was negative thoughts, just that he's going to go through this, but he's not going to come through.
Just 1 minute.
If anyone in the department has paged the urology registrar, they are on the phone in resus. Please call extension 2398 or come to the phone. Thank you. It's the second time he's wrong.
Fierce tonight, eh?
I'm in a shitty mood.
What's wrong with you? What's wrong with you?
I'm tired, but I don't like being in a bad mood.
Well, you're working with me now.
So that's a reason to be in a bad mood. Sometimes it does feel a little bit like you're in a war zone. And I think, I'm just not sure how that didn't all go really pear-shaped, but somehow we manage. It's a team, and I can't do my job without the nurses or the porters and the techs. And that's one thing that I really love about emergency medicine. I like the fact that it's a community feel.
You know you've got to always wait.
My job puts everything in perspective. Very rarely can I not come home from a day at work and go, you know what, I've got nothing to worry about. It puts it all in perspective.
Hanie, do you know where you are? Can you speak to me? Can you speak to me?
I'm just so glad that I never succeeded. You know, the hospital, the nurses, the doctors, I am grateful. They did save my life. Thank you is I don't know. What do you say to somebody who saved your life? You know, thank you seems very little.
Since he's getting better, have you told him that you love him?
No.
Don't you think you should?
I think he knows. I'm just like him, I guess. He wouldn't say it to me, and I couldn't say it to him. I don't know. It's just us, the way we are.
That's that thing, isn't it?
And what's made you come in this morning, then?
Nothing special.
Oh, God, can you just stop hurting, please? Just for a second, just be like, you know, be cool. Silly leg.
I just wanted to ask you, Duncan, what was your surname?
Fall from a tree, 25 foot. He's probably absolutely trolleyed, I'd imagine, if he's up a tree. Kings A&E. Lovely. Cheers, bye.
Adult trauma call, 8 minutes. Adult trauma call, 8 minutes.
I've got an unconscious gentleman he has severe traumatic brain injury.
Kings College Hospital, London.
I think something hurt.
One of the busiest A&E departments in the country.
They're a bit busy right now. Yeah, 15 minutes, 30 minutes.
Kings is extreme, isn't it? Come on.
A place where love, life, and death unfold every single day.
Fall from a tree. He's probably absolutely trolleyed.
I'm very drunk.
I just keep thinking, how am I going to cope?
All the patients you're about to see were treated in one department in just one 24-hour period.
Kevino.
Everyone should walk through an emergency room at least once in their life because it makes you realise what your priorities are. It's not the rush, rush, rush and the money, money, money. It's the people you love and the fact that 1 minute they might be there and 1 minute they might be gone.
Unbelievable, that woman.
It's a 1,000 mil bonus.
Suicidal!
You're doing nothing about this! Bring it down! For God's sake! Or kill me!
What's she going on?
I don't know.
Kings College Hospital is regarded as one of the best at dealing with issues relating to the brain and mind.
Shut up! You know nothing of pain! Shut up!
Johnny, behave yourself.
Slurred speech.
As a result, the A&E department handles more neurological and psychological emergencies than any other in the country.
There's a stroke, yeah.
The unpredictability of what can happen with the brain and the mind is the scary thing, you know, and it's hard to fix, and it's hard to understand.
All right. Hello, Mr. Thomas, is it? What is it that's brought you to hospital?
I did this morning call Dora telephone.
Sorry, excuse me. All right. I'm just going to go and answer that. Let's just pop you up on this bed. Are you right if just I give you a hand to stand up?
Okay, my nickname used to be called the Memory Man.
You right?
I've always had the ability to remember, you know, Grand National winners, Derby winners.
There's another one for you on your list. The gentleman in 11. He's actually a query stroke. Oh, okay. Thanks.
61-year-old Clive is a former betting shop manager.
Somebody the other day asked me, what was the name of the horse that won the 1961 Grand National? I can't remember. I said it was Nicholas Silver, which was a grey horse, and that won the Grand National in 1961.
Hold your hands out nice and high for me and just keep them up like that. And then just stop me pushing them down. Okay, that's good. All right, that's fine. Just relax. Give my fingers a really big squeeze. Good. Relax and just look at me.
On the particular day, I woke up very, very confused.
Raise your eyebrows up. Like this? No.
When my wife woke up and we started speaking, she said to me, "What's the matter with your voice?"
Good. Big smile. Show me your teeth.
And she said, "It sounds like you've been drinking," which I hadn't.
That's it. Can you feel me touching?
Yeah.
Does it feel the same on both sides?
Yes.
All right then.
Well, one thing I must make one comment. You look very young to be a consultant.
Thank you very much.
That's all right.
That's obviously just my parents' good genes, maybe. Otherwise, maybe your vision is blurry. I'm going to leave you in the hands of the nurse. We're going to put a drip in your hand, and I'm going to come back, and I'll probably bring one of our stroke doctors back as well to have a chat to you and organise a scan and a few other tests, okay?
Okay, Jackie.
Can we get an ECG and stuff as well?
Thank you very much.
My name is Irene.
I was run over by a taxi on Friday. I got a very big cut here, da-da-da.
Oh, pardon me.
Just go on like this all day long, do you suppose?
Eh?
Just go on like this all day long for like 24 hours. This A&E.
Who's that?
Is this A&E, would it be 24 hours?
I would have thought so. Yeah.
Do they come here for all sorts of A&E stuff?
Yeah.
She gave that one a squish, and she said something about a fracture or something about needing to be seen.
26-year-old Jodie's evening plans have been cut short. She's trapped her hand in a collapsible chair.
That's the word that I was thinking, you know, when he said he said a posh word, not a posh word, but a technical word, or something that I didn't know what it meant. Do you know what triage is? Faire le tri. Le triage. It means, I know what it means. When me and Petra were grape picking, we had to do le triage, which is when you separate the bad grapes from the good grapes. So what it means is like a separating, like a kind of filtering process of like what's important and what's not.
Oh, right, okay.
Yeah, triage just means sorting.
But what's the horses thing? Dressage. Totally different. Totally different.
Triage. Dressage. Oh, I can't believe I'm missing this concert. I thought I would have got there.
Have you ever been to A&E before?
Yeah.
They won't let us out for a while, though.
When you're in A&E, you don't know who your patients are, who they're going to be today.
Kings A&E, can I help you?
You've just got to be prepared for anything.
All right, bye-bye. Can you put out a stroke call for A&E resus now? A 16-year-old query stroke.
16-year-old query stroke?
Yeah, this chap here.
16?
1-6, impressions stroke. Great, the 16-year-old, apparently they've just pulled up outside. Query stroke is sketched by neurosurgeons. 1-6, impressions stroke.
I got a call from the school to say there's been an accident involving one of my sons, it's Joseph. And at first I thought maybe it was something minor, like a little cut in there and there, and they said no, it was quite a big one. All they knew was he was lying on the floor, motionless. And Elijah kneeling beside him, calling his name, Joseph, Joseph, are you all right? And he couldn't say anything.
I just looked at him like he was just sitting on the floor, head down. And I was just mad, man. I was just angry. I just didn't know what to think. Just didn't know how to feel. I was just bare talking. Nobody could talk to me. And like, yeah, I just couldn't explain it. Like, just couldn't, put myself together, like, to see what happened. I was just concerned about him, like, it's just a hard time. It's a hard time.
We're going to go up here into 4.
I think he must have regained his consciousness in the ambulance. As he said, the first thing he saw when he came around was the white, the inside of the ambulance, and some men talking over him. You need to find out exactly what happened. Where were you? What was your last subject? Where were you going? Did you actually play football today?
Yeah, I was in goal.
Huh?
I don't know, you wasn't playing with me though.
I was playing football today.
Might have been yesterday.
No, I came down from the cafe you were there. I had jollof with you.
That was yesterday.
That was yesterday, yeah.
That was yesterday.
Let me start from the beginning, yeah? Okay, fine.
Okay.
This morning I woke up around 7. I think we went downstairs to bath.
I don't know what it took about.
Okay, fine. This morning, what's it? You took my laces, right? The black ones, my black shoes. And
That was yesterday.
Joseph, I think you're talking about yesterday, not today. Because today you actually woke up late. So you were talking about yesterday, Joe.
Oh. You talk about yesterday.
So maybe yesterday. Did you remember playing football with him yesterday?
Yeah, I was playing football with you yesterday.
Football yesterday. So maybe.
I think I am talking about yesterday.
You talk about yesterday.
You were talking about yesterday.
Because I don't remember putting on my white cardigan.
You didn't remember putting on what?
My white cardigan. My white jumper.
White cardigan. Oh, the jumper. You didn't
I don't remember
putting
putting that on. So I don't remember what happened today.
Yes, you need to find out exactly what happened. Where were you? What was your last subject? Where were you going?
A stroke means a blood vessel supplying a part of the brain gets blocked. As a result, that part of the brain loses its function.
Hello.
Very young people can have severe disability from stroke.
Yeah, that's it. Hi, lovey. We're off to City.
They have huge swelling from the stroke if it's not treated appropriately and can kill them very rapidly.
Having been assessed, Clive is waiting to find out the cause of his speech problems.
It's going to sting a bit, but try and keep your arm nice and still for me if you can.
Okay.
We don't want you to escape. We put on your name tag quite tight.
If there was an escape, I wouldn't try and do that. Do you ever get people leave here during examinations?
Yes, you do from time to time.
I don't see the point in that.
Sometimes people get a bit scared.
Do they?
Yeah.
Oh.
They feel they don't want to stay and find out what was wrong with them.
Really? Well, if anything is wrong with me, I'm one of those who doesn't want to know. I'd like to know.
Yeah, it's best to know.
I've known people that have had strokes and the quality of life just goes out the window and they become very reliant on having to have constant help.
How does that make you feel when you...
Very annoyed.
You like to be in control?
Absolutely, yeah.
Sorry, I'm just putting this back up again.
OK. Thank you, Charmin.
Yeah, no problem.
Thank you very much. I become very anxious and depressed when things don't go, right for me. I am on antidepressants. I've been on 5 or 6 years. I've been using those. I'm not the same person. People have said that I'm not the same person that I was sort of 10 years ago when I was full of confidence and but it's this depression is pretty bad. It's something that some days are worse than others. You get the occasional good day, but you get more bad days than good days. Sometimes I think, should I go back to work or try? But I don't think I could do it. In fact, I know I couldn't do it.
And that's all because of what's going on in your
What's
head?
going upstairs, yeah. That's right.
Well, she's got this incredibly pert type of, and literally, you'll be in like a queue for a pizza in a pizza takeaway shop, and you'll suddenly realise, like, you'll look at all the men and
They're all actually staring at her.
and you don't realise the power of a bum, really. Like, I'm thinking sometimes, they must be looking at something else, but they quite literally are. Or you'll be in a bar, because obviously when you're drinking with someone, you're face to face, so all you can see is all of these eyes behind her. You're talking to her, and all you can see is all of these eyes.
Looking at her bum.
And her bum.
That's
and you would never know that people were so obsessed with them. Oh, that's me, that's me.
Hello, can I help you? Hi. Could you ask someone to do a welfare check on someone who's gone missing from the department? She's not under any section. She's an informal person who says she's suicidal, and she has a history of 74 previous suicide attempts.
Jenny is a psychiatric nurse. She's worked at King's for 3 years.
I started off as a police officer, and then I went into a women's prison and worked with drug rehabilitation. Hello, Kirsty, it's Jenny here. I'm one of the psychiatric nurses in A&E at King's. I'm trying to find your mum because your mum was brought in, but I went out to see her and she'd already disappeared. I've also been a dirty phone line operator, so I don't think you can look at someone and see the whole package. And that's a big learning curve as to what men and the world's all about, I can assure you. Different ends of the spectrum, I suppose. It's still all human behaviour. I know, you've had to put up with a lot over the years, haven't you?
How many mental health patients do you see a month at King's?
I think it's about 300 in a month. We see more people with mental health needs than any other A&E department throughout the UK. All right, my dear, try not to worry too much. Bye-bye, love. Did you see that when they brought me a cup of tea, At about 5 o'clock in the morning, she got up to try and go, and I said to her, look, I've sat with you all night now. Would you just let me have this cup of tea before you try and gouge your eyes out or run away again? So she sat down and let me drink my cup of tea, and then she started gouging her eyes out as soon as I'd finished it. I was quite grateful to her, though. A lot of people would love to come into the care of mental health services by being in hospital. It's certainly very busy at night time. Very, very busy, and I think sometimes that's because there is nowhere else to go. It can seem an awful long time between drawing the curtains at 5 o'clock when it gets dark to waking up the next morning.
A regular visitor to King's has arrived. He has schizophrenia and is well known to the mental health team. This time his problem is a medical one. He hasn't taken his diabetes medicine for the last 4 days.
Yeah, I think it's... So have you not been taking your insulin now? For 4 days, why is that?
I don't know, time.
You haven't had time?
No.
You need to make the time for that kind of thing. It's really, really important.
He was recently discharged on the 11th of November, admitted then for chest pain and hypoglycemia, poor compliance. He's coming with the same thing again today.
Excuse me.
Hello.
I'm going to go out for a cigarette.
When? No, not for a little while, unfortunately.
A couple of hours.
Yeah, at least. If not a lot longer than that, maybe not even overnight. Because we need to get your sugar down, and we're worried about your heart at the moment. I know, but we're worried about your heart as well. I know. I don't doubt it, but it's more about we need to keep a good close eye on you, and having a cigarette ain't going to help.
We see a lot of people who have schizophrenia. We see a lot of people with bipolar disorders, mainly when they're in their manic phase, so their behaviour is very outlandish, especially if it leads to disinhibited behaviours.
Doctor.
Hello.
Change the drip. Can I have a cigarette? Will you change the drip?
I don't think you should have a cigarette, sir. We can't change the drip. I don't think it's very wise, sir.
If you're behaving abnormally, it doesn't make you the best company generally, so it's a very difficult thing to deal with.
Doctor.
Yes, it does. I've already spoke to me.
Can't go and have a cigarette. I'm going to go and get you that cup of tea, all right? And a sandwich. That'll have to do for now. I'm going to go out now.
Please. Doctor. Doctor. Doctor.
What's the matter? You can't go out for a cigarette just yet. You're having some medication which you need to have, okay? You're too sick to go out for a cigarette at the moment. And there's no one to take you out for a cigarette. My colleague's already told you.
Have this instead, right? You got it? 2 of them there, yeah? And don't forget the cheese there as well.
Nurse. Nurse. Can you put it in a bin, please?
Yeah, sure, no problem.
Ready? Your letter is going to be the letter B. On your marks, get set, go.
Burger. Bog. Blimey. Bog, I said.
3.
Bother. Borage.
Borage is not a word. Speak him out.
Bell. Born. Bean born.
Stop! That is 25. Jodie, you've got 25. 34 is a record. 25 is really...
Okay, I'm going to give you S. Go.
Sugar. Sweet.
And you
Cinch.
can't sing yourself.
Synchronised. Snitch. Snatch. Shalom.
I think an A&E department deals with people in every aspect, not only with the broken bones and the cut finger and the dodgy ticker. I think that it's a place that people see as safe.
I haven't received the scan results yet.
That's the machine, the machinery.
It's a place where they can come when things are out of control and they need somebody to look after them.
The diabetes patient will have to spend the next 4 hours attached to a drip. He's a regular to King's, well known to the mental health team. Tonight's visit is his 19th in the past year.
Now, we're just going to move you around the corner. Okay?
All right.
Before you ask, can't go for a cigarette.
All right.
I know that's what you're thinking.
All right. Let's go for a cigarette. Okay,
No. Oh, what timing. Very lovely, thanks.
No, I will show my bag, please.
Yep.
He lives in a council property with support from regular carers. He challenges this by some of his behaviour. He can not be very welcoming at times, let's say.
I've got your clothes in there anyway.
Well, I've got my money, my phone.
I'll have it, one sec.
Fuck's sake.
There are times when he can't contain life at home like that anymore.
Come on. Blue plastic bags in there.
The basis of that is loneliness. Some of that loneliness may be caused by that behaviour which challenges social relationships.
Come on, hurry up. Hurry up. Oh, fucking hell. Oh, fucking hell. Nurse. 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 Doctor, I don't read all this shit.
This is the last time. You can't keep calling out. We're busy, okay? What do you want?
Oh, a cigarette.
How many times have we been through this? You can't have a cigarette. It ain't happening. You can ask as much as you want. The answer will still be no.
Yes.
Right, you see this? You're attached to this machine, which is keeping your blood sugars from making you collapse. Right? No, you're too unwell this time.
My wheelchair's in there.
No, you're not wheeling yourself out. No. You're too unwell. You're not going for a cigarette. Okay? Don't ask again. Because the answer will still be no. Okay? And don't shout out nurse for at least another 10 minutes. Okay? Is there anything you're going to need in the next 10 minutes? Good. I don't want to hear it because no one will come calling. Okay? Right. Yeah.
I can lift this one up, but not this one as much. Not really, I can't bend it.
16-year-old Joseph has been brought to King's because paramedics believe he may have suffered a stroke. He and his twin brother Elijah have been in A&E for the last 2 hours. They're waiting for his brain scan results to come back.
Just don't go straight into football.
I'm not.
Don't go straight into.
First, I want to just sit down and just watch
like,
first.
and just like gradually build up. Maybe just.
I'm not gonna go straight into football. I'm just gonna practice catching the ball first.
Try and walk it off, and then start jogging. After you jog, you can now sprint and that.
Most of the time, I think they can't wait to kill each other. That's the way I can describe it. But when I saw him that day, genuinely, I thought, oh my God. You know, we love this boy. His brother loves him. So yeah, and I'm praying in my heart that, God, please, this boy, he doesn't want to lose his brother.
You say A, I say A, you say B, I say B. You say C, I say C. And on and on and on.
Oh, right, yeah.
Yeah, famous people, yeah.
Famous people. Arnold Schwarzenegger.
Is that the first time you've had to think about what life would be like without your brother?
Yeah, yeah.
Give me that, relax. Try and close your eyes and sleep.
It's G, no, look at your thing. Q. Oh my days, Q is easy.
Queen Latifah.
Like, I was just thinking, I guess this is how my brother is, this is the end. That's what I was just thinking about, is this the end of me and my brother? Is he gonna be staying in this bed for long or something like that? And the thought that just came to my mind was, how are you gonna, like, I just wanted them out there, you know what I mean? Just wanted them just back the way it was normal, like.
Zed. I'm ending.
Zed.
I'm ending it. So you saying it? You said what?
Wait, let me see. Wait, I haven't said mine yet.
Come on, just say it, Zoo. Just say Zoo. Just say Zoo.
Zoo.
Fine, let me end it. How many letters left? 0.
Oh yeah, 0. No, that was good, you know. How many letters left?
0.
Imagine.
No.
And he still got the question like
You got that recover. Oh, fine. Okay, good.
Get left hand,
No, don't.
Put your hand down. Rest it. Heart rate, rest it.
So this is how we'll go fast and we'll go smash your head.
This body. Safe.
Attitude.
Joseph, we're going to a ward shortly, okay?
Okay, ward. Are we going to ward shortly?
Yeah.
Which ward are we
Friend
going?
stroke unit.
Friend
stroke unit.
Friend stroke unit.
Yeah.
Okay. Thank you. One of the see friend stroke units.
Wow, I had stroke.
Okay, Nobody wants to say the word stroke. and I'm trying not to say the word stroke to myself as well. And we try not to tell Joseph that this is what they say it might be. We're thinking that, okay, you have a weakness. So I like to think that it's a weakness on one side of your body. And we think that you might pull through. And I'm trying to prepare him to say, just in case you can't pull through, what do you think will happen? How will you react to it? And he said, Mom, are you scared? And I say, I am very scared.
Right, we're going to take you upstairs now.
He was the youngest on the stroke ward that night. It's scary. Every time you went on the ward to look at him, you're meeting all these old people. And then it's like, oh my God, what is he doing here? He shouldn't be here. He doesn't belong to be here.
"61-year-old Clive is also waiting to find out whether he's had a stroke.
Hello, my name is Kumar, one of the registrars. How are you?
I'm all right. My wife noticed this morning. I'm not as articulate word-wise.
And how long do you think this has been going on?
This is since last night.
Last night. Okay, look at me. Look at this. Can you follow this for me? Dear me. Look at me. Tell me which finger moves. Keep looking at my eyes. Yeah, tell me which finger moves. Can you see this finger moving?
Yeah, which one?
Point with your hand. Which fingers are moving?
The four.
Now?
3.
Okay. Can you feel me touching here?
Yes.
Is it equal both sides?
Yeah.
Can you raise your eyebrows? Close your eyes very tight. Tight. Keep your lips very tight. Can you turn your head that side for me? So what other medical problem do you have?
I'm an alcoholic. I've been abstinent 3 weeks today.
Okay. Can you put your hand out straight for me? Open your eyes for me. Put your hand out straight. Good. Now close your eyes. Good.
When did you start drinking?
I started drinking when I was 12 years old.
And do you have any other medical problems at all? High blood pressure, diabetes, anything like that?
No, I'm on antidepressants.
Antidepressants. Use this index finger, touch your nose for me.
A friend of mine, his father had a pub in Highgate Village. We started helping ourselves to the drink. That's how it basically all started. Plus alcoholism runs in my family.
So you are an alcoholic?
I'm an alcoholic. I always will be an alcoholic.
Can you do this?
How much were you drinking then when you were in the height of it?
Between 8 and 10 pints of Guinness and probably about half a bottle of whiskey a day.
Okay, how many fingers can you say?
8.
Huh?
8.
8?
8 and two thumbs.
8 and 2 thumbs. Okay, that's 10. Good. Okay, that's more.
You used to go to work?
Oh yeah, that never affected my work. My father was an alcoholic and he used to say to me, the day you can't go to work because you're hungover, stop drinking. And I never missed work due to alcohol.
Okay. Can you bend your head? Okay, no managers up. That's good.
Thank you very much.
Thank you. I'll see you with the scan results, okay?
Okay, so thank you very much.
Okay.
Okay,
and then,
Tom.
That's fine.
Okay, darling.
So, this one on.
What's your name, darling?
Capri.
Capri. I've got no. I like to know people's names.
Yeah, that's good.
Yes, I don't.
Obviously, you want to know who's looking after you, don't you?
Alcoholics are susceptible to stroke by various, risks. They can have very high blood pressure, high cholesterol, and also they might have the medical illness like alcoholic cardiomyopathy, where that they might develop irregular heartbeat. As a result of it, they throw up clots to the brain. So we have a very close eye on people with alcohol overusage when they come into hospital with a stroke.
Is it fair to say your brain is now kind of your enemy?
Oh, you could say that, yeah. Yeah, you could say that. Because, and then the brain triggers you, says go to the pub. That's what triggers it all.
If there's a storm out at sea, you go into harbour just to anchor you down while the storm's passing. And I think that if that weren't there, you're tossing around in the water on your own and you're likely to sink. And so we just have to be that hard place you can tie yourself onto for a little bit so you can get to the other side.
Alongside all the injuries and illnesses seen in A&E, Kings also opens its doors to people who are emotionally troubled.
I'm Jenny, I'm one of the psychiatric nurses in the team.
A young girl has arrived, in crisis and struggling to cope.
Before we go any further, where's baby?
She's my friend.
Yeah?
It's like whenever I feel depressed, I leave with the friend that I can trust. It's like, I don't know, it's like I'm getting ready to say bye to her. If you get what I mean.
How are you finding it being a mum on your own?
It's hard. It is hard. As you can tell, I'm never making the right choices.
Well, I don't know that.
No,
I know it's difficult.
I feel like I'm a bad mum because I let her see me getting treated horrible by men. She was sleeping, but she had her hands over her ears, and my friend asked her, "Why do you keep doing that?" And she said, "Because of mummy, she's singing Twinkle Twinkle Little Star," and she's saying, "Because I keep arguing." It made me feel sad that my daughter's having to do that. But no one's there, no one's arguing no more. But even to let her do that.
Is this the past boyfriend?
Yeah. And when she found out we was moving, She was in the car and she was like, we're going to have a fresh start now, Mummy. Things that she shouldn't be saying. She's only 3. I feel bad. I really do.
Some nights we see 1 or 2, but it's not unusual to see somebody most nights of the week now, children. And I'm talking about children, I'm not talking about teenagers. Suicide attempts, all sorts of things.
So how old is the youngest suicide or suicide attempt or someone with suicide tendencies that you've heard of?
In the department, about 7, I think.
Ready, steady, pee.
Deceptive, pink, prize winning, poodle.
Prize winning, you can't have 2 words.
Yes, I can. It is 1 word. Prince, princess, posh, pickle, printing, press, purple, porthole, paddle.
Oh!
Parrot.
1 more minute. Stop.
Pashmina.
Stop. How many?
25. Sorry, mate, put you into post by 1.
Did I not get 25?
You got 24. So I give
I'm
you
going to
one,
really concentrate this time. I'm not even going to look at you. This is going to be like... This is going to be it. This is my big time.
Miss Garrod.
Oh, God.
Miss Garrod? Judy.
Yeah.
Hello, come here. Come with me.
Right.
Well, I can do your dressing so you can go home. What you done?
I trapped my finger.
Oh, my goodness.
In a collapsible stool.
Oh, dear. Rest your hands on mine.
It can be very addictive receiving care. I've had a problem with my heart at one stage, and you get taken into a hospital and there are nurses who talk kindly to you. They give you their full attention. They look after you and they get you to a better place where your heart's okay and you can go home. But if you need to do that because it's about your personality or your mental health or your mood, you become a revolving door patient because it's actually quite nice to come and receive some care. Number 3. Just going to go in. Hiya. How have things? I'm from the psychiatric team.
Yeah.
How have things been at home recently?
Oh, really horrendous.
Have they?
Pretty horrendous, yeah.
What's been happening?
I can't cope, I can't look after myself. I'd like to go back in the hospital.
Yeah, I know, but nobody can live in hospital forever, can they?
So get me somewhere better to live.
Well, what's wrong with where you live?
I've got to get out of there. I can't look after myself. I want to go back to the hospital, please.
Well, at the moment, you're not very well because you haven't been taking your diabetic medication properly.
Yeah.
And they're trying to see what's been happening with your chest today. While you're here, the psychiatric liaison team will come and see you and see what's happening for you.
Thank you.
All right?
Thank you.
So we want to make sure all of you's all right. Mental health doesn't make you the most popular person to be with. It's the knock-on effect on where he fits into the world and where he's comfortable in the world. Because his life is alone and is lonely. And it's those things that he wants us to fill in for him. And with the best will in the world, you can't medicate for loneliness. Is there anything in particular that's distressing you at the moment?
Everything.
Everything? Okay. We're all as vulnerable as each other, and anything can happen to any one of us and just trip us over into mental health, and it's a hard place to get back from. Well, you need to relax. You're a safe place at the moment. for some of us, life's going to be okay. And for some of us, it can change dramatically without any warning. And I think that's very scary.
1 in 4 of us will at some point in our life suffer from mental illness.
I've got a very lovely and understanding wife. I mean, many people would have left me years ago.
The brain scan results for former betting shop manager Clive are inconclusive. But because of his history as an alcoholic, he's being kept in overnight.
Hello, sir. Hello, sir. What are your odds?
The odds of me keeping sane are evens. That's 50-50 either way.
What about your odds of staying dry?
Odds of staying dry, well, that should be an odds-on chance, but it's not. Over what sort of period? Forever. The odds of me staying dry forever, probably 100 to 1. Probably.
Kings A&E.
Thank you.